Hi, everybody. I'm Dr. Brian Ardis. This is the Dr. Ardis Show, and I'm excited to spend some time with you today, educating you and all of you at home and anyone you love about the truth about tetanus. Ever since I've been born, which was in 1976, and everybody else that's out there, you've all heard this thing called tetanus and the requirement for a vet at some point in your life. And then you've also heard that this only comes from rusty nails. You might step on out in the woods barefooted. I find that interesting that all of us still go to pediatric clinics. We all go to our medical doctors each year, and you're going to be told you need to have an updated tetanus shot. And the majority of you all think this only comes from rusty nails you might step on one day. How many people in America step on rusty nails to be concerned about a bacteria that might live on rusty nails called tetanus? Not very many of you. So then my next question is why do all of us in America, if you're not stepping on rusty nails? Well, if you'd like to know about the truth about tetanus, so it's time to break down what are the actual proven cures from nature that kill the bacteria that is called tetanus and the toxins it releases in your body. Did you know that things like vitamin C have been known to be a cure, and there's a specific dose that cures 100% of all children who have ever had an active infection of tetanus, and 100% of them live just being given a certain dose of vitamin C? And then I'd like to ask you, how come your pediatrician doesn't tell you that? Make sure your child gets this amount of vitamin C every day to prevent tetanus. Well, it's time to educate you on everything you need to know about tetanus. You didn't watch the end of this presentation. And remember, you can go to thedrardisshow.com. You can actually go to the resources tab and download the PowerPoint of this presentation in a PDF form. It's just one document. That's all the slides I'm about to show you with all the highlighted research study proving that there's natural cures for tetanus that you're not going to be told by your medical professional. I'm going to show you what medical science has proven are effective treatments of tetanus. You'll be shocked by some of these that you were never told. Make sure you share this far and wide. You don't need it unless you just don't know the truth. And like I often say, ignorance is not always bliss. Well, for all of you out there who would like to not be ignorant, when you show up to your medical doctor and them tell you need a test, or end up in the hospital with a wound and they tell you, are you updated with, you can tell them, nope, I actually took the adequate amount of vitamin C as shown by Dr. Ardis on the Dr. Ardis Show per the medical research papers. That's what you're about to learn. All right, so here we go. Let's dive into the presentation on everything you need to know about tetanus. Remember, the resources tab, you can actually scan. This is tetanus, handled naturally. But this is a QR code. You can scan it, put in your email. You'll get notified each week of my upcoming events, my podcasts I'm coming out with. Each week I produce one podcast, just like this one, to destroy the narrative that you're taught about in medicine and in the mainstream media about specific health topics. I'm going to take you through what Big Pharma wants you to believe and what the American medical industrial complex wants you to believe, and all they're going to tell you and what they want their medical professionals to repeat to you in their offices. I'm going to show you what the medical research that is funded by the same pharmaceutical industry, what they already know the truth is in nature. They just don't want to tell their medical professionals who are there on every corner of every urgent care center, ER center. They are your current corners. They want you taking their drugs instead of knowing that nature has already provided the antidote. Scan the QR code. Here we go. All right, what is tetanus? This is the Mayo Clinic. They are supposedly a very reputable hospital institution out of Wisconsin, based in Wisconsin. What does they say about tetanus? Tetanus is a serious disease of the nervous system caused by a toxin-producing bacteria. The disease causes muscle contractions, particularly of your jaw, neck muscles. Tetanus is commonly known as lockjaw. Severe complications of tetanus can be life-threatening. And Mayo Clinic for sure wants you to know there's no cure for tetanus. Well, I'm about to actually show you 6 by the time I get done with this presentation that even the Mayo Clinic doesn't even know. Isn't that weird? I'm going to show you medical journals who publish cures for tetanus, but the Mayo Clinic tells you there's no cure for tetanus. Maybe they're just being honest and telling you there's no cure for tetanus at the Mayo Clinic. There you go. And in that case, they would be honest because they're not going to give you these. All right, what are the symptoms of tetanus, the incurable disease? The most common type of tetanus is called generalized tetanus. Signs and symptoms begin gradually and then progressively worsen over 2 weeks. Signs and symptoms of tetanus for all of you to look out for: painful muscle spasms and stiffness, immovable muscles, muscle rigidity in your jaw, tension of muscles around your lips, sometimes producing a persistent grin, painful spasms and rigidity in your neck muscles, difficulty swallowing, rigid abdominal muscles. Progression of tetanus results in repeated painful seizure-like spasms that last for several minutes. Usually the neck and back arc, the legs become rigid, the arms drawn up to the body, and the fists are clenched. Muscle rigidity in the neck and abdomen may cause breathing difficulties. These severe spasms may be triggered by minor events that stimulate the senses. A loud sound, a physical touch, a draft, or light can trigger these symptoms of tetanus. Well, let's go look at the Cleveland Clinic. We've already talked about the Mayo Clinic. Cleveland Clinic, in case you're wondering where that's based out of, is in Cleveland, Ohio. All right, tetanus, known as lockjaw. They want you to see the same characteristics and summaries of symptoms. Tetanus symptoms happen because the toxin from the bacteria disrupts your nervous system. The main symptoms include difficulty swallowing or breathing, drooling, face muscle flexing, causing a rigid smile, inability to open your mouth because of muscle tightness, muscle spasms in your abs, back, arms, or legs, which light and sound can trigger, overextending your neck and back because of muscle spasms, and seizures are all symptoms of tetanus. Now I'm going to zoom into the blue graphic on the right. They show you simple graphics or illustrations of the symptoms they were just describing. Tetanus makes your muscles flex uncontrollably. That can look like this: difficulty breathing or swallowing, face muscles causing a rigid smile, jaw muscles holding your mouth tightly closed, muscle spasms in your abs, back, or limbs. Now, if we go to medical news today, another medical industrial complex, very reputable online journal. Everything you need to know about tetanus article. A wound likely to develop tetanus is defined as this. This is typically how you get it, which is why if you ever have an injury or a wound, they're going to go, are you updated on your tetanus shot? So these are the examples. A wound or burn that requires surgical intervention that is delayed for over 6 hours. A wound or burn that has a considerable amount of removed tissue. Any puncture type injury that has been in contact with manure or soil. Serious fractures where the bone is exposed to infection, such as compound fractures. Wounds or burns in patients with systemic sepsis. These are examples where they state in medicine tetanus infections can begin, most likely. Doctors may prescribe penicillin or metronidazole for tetanus treatment. These antibiotics prevent the bacteria from multiplying and producing the neurotoxin that causes muscle spasms and stiffness. But you're about to learn it doesn't always work. In fact, the majority of the time it doesn't work. The CDC says about tetanus vaccinations, the only way to treat it is through vaccines, supposedly to prevent it. People of all ages, they say at the CDC, need tetanus vaccines. And here's the recommended age groups and types of vaccines for those people. So for children, adolescents, and preteens, you'll see Tdap and DTaP vaccines. And then for the adults, you'll see TD or Tdap vaccines. Remember, the D stands for diphtheria, T stands for tetanus, P stands for pertussis, otherwise known as whooping cough. All right, so for young children, it says they need a tetanus vaccine at 2, 4, and 6 months old. 15 through 18 months old, they need another one. And 4 through 6-year-olds, and then they need another one between 11 and 12 years old. And then every 10 years for anybody who's a senior, older than 55 years old. There are 3 types of combination vaccines that include protection against tetanus, says the CDC. Those are known as Tdap, DTaP, and TD. Types of tetanus vaccines, you're going to see them here. Vaccine providers for DTaP give up to 5 DTaP shots to babies and young children. Here's the names of these 5 shots that you will see for children. Daptocil, Infanrix, like Infanrix, Kinrix, Pediarix, Pentacell, Quadricell, and Vaxxel. Vaxcells. I think this says Vaxcells. Vaxellus. There you go. There's the brand names for you. Tdap vaccines. Tetanus, diphtheria, and pertussis vaccines. There are 2 Tdap brands, Adacel and Boostrix. Vaccine providers give Tdap to people 7 years or older. This is per the CDC.gov. You see their address at the bottom of the screen. This is exactly where we got this document. As a preteen or teen, it's recommended during pregnancy. Whoa, during pregnancy. All right. As a booster every 10 years, TD is another option for those boosters. As part of a 3-shot series for those never vaccinated. And to complete the childhood vaccine series, if needed, you can use the Tdap vaccine. According to technavio.com, tetanus toxoid vaccine market analysis, in case you didn't realize this was a billion-dollar singular industry, tetanus vaccines. Tetanus toxoid vaccine market analysis for North America, Europe, Asia, and the rest of the world. US, Germany, UK, France, Canada, size and forecast between 2024, we're in 2025 right now, as of this recording, until 2028. Tetanus toxoid vaccine market size. The tetanus toxoid vaccine market size is forecast to increase by $1.24 billion annually between 2023 and 2028. $1 billion annually? Amazing. You'll see down there the volume of revenue generated by tetanus vaccines alone from 2018 until 2028, continuing to grow in its value. If you want to know why it is they don't want you to know about what I'm about to show you, this is why this one singular vaccine, Tdap, DTaP, or TP, are all billion-dollar industry products. Well, if you actually got tetanus, even if you were vaccinated, what do they prescribe for tetanus? I already showed you one drug. Well, let's get into penicillin. Penicillin, and its brand names are Bicillin, LA, and Extensilin. These are penicillin. Penicillin is offered for tetanus if you have a tetanus infection. I want to show you this. There have been reports of inadvertent intravenous administration of penicillin, which has been associated with cardiorespiratory arrest and death. Penicillin intravenously, which they use to treat tetanus infections, is known and is associated to cause heart and lung arrest, meaning stop, can't breathe, can't beat, and death. Ask your doctor if penicillin injected inside of you intravenously is right for you or your child if they're diagnosed with tetanus. Local adverse events. Now, frequency not reported. This is a penicillin being given to you intravenously. I want to read to you what you see on the screen. Don't read the bottom half yet, just the top. These are outside of human trials, the people that continued receiving penicillin intravenously after the trial and data were collected. It is reported all of the crap at the top of the screen are published known side effects, but they don't have a data amount of people that have these problems continued with penicillin intravenously. All right, here we go. You'll have injection site reactions, including pain, inflammation, lumps, abscess, necrosis. That's death of tissue in your body, edema, hemorrhage, cellulitis, infection in your skin, hypersensitivity, atrophy, loss of muscle, ecchymosis, skin ulcer, neurovascular reactions, including warmth, vasospasm, pallor, going white, mottling, gangrene, numbness of the extremities, cyanosis of the extremities. That's death of your arms and legs. You have to have them amputated. Neurovascular damage are all side effects of penicillin. Wow. All right, now I need to define for you what frequency not reported here means in all drugs. When you look on drugs.com at side effects, you'll see this. You'll see heart side effects. And we know this many percentage of people will have this problem. And then there's always this frequency not reported. That means simply, we didn't, as a drug company, collect the percentage of people who had these problems when taking our drug after the trial ended. But there was enough of them reported. We have to make sure you're aware per the FDA's requirements. Read with me together. This is from drugs.com. If a side effect has the words frequency not reported, then this means that neither the product information nor clinical trials have specified exactly how many people have experienced this side effect for this particular medicine. Sometimes side effects are not reported until after a drug goes to market. When this happens, there's no way to know how many people have experienced this side effect reliably. Just know the drug causes all these problems. We just don't have the ability to collect all that data and report it back to you what that number is. So I'm going to run through the frequency not reported, After the trials ended and the penicillin went to market, what are the commonly reported side effects of penicillin intravenously? Well, hypersensitivity. You'll see some things underlined. Hypersensitivity. Look at that underlined statement. Anaphylactoid reaction, including shock and death, have occurred with penicillin intravenously for tetanus. Ask your doctor if shock, respiratory arrest, and death are right for you. Cardiovascular wise, cardiac arrest. That means your heart stops. You know what happens to somebody when that happens? Well, unless they have an AED device to shock you back to life, you're going to die. Hypotension, tachycardia, palpitations, pulmonary hypertension, high blood pressure in the heart, lungs, pulmonary embolism, blood clots, vasodilation, loss of blood flow, vasovagal reaction, throwing up and vomiting, cerebrovascular accident, and cyanosis. Cyanide poisoning are all published side effects of penicillin after it went to market, but they never figured out what the numbers were of people who experienced this. Ask your doctor if these side effects are right for you. If you're prescribed penicillin for tetanus, I just need you to know, for the nervous system, seizures, coma are underlined. Neurological reactions, underlined. You can read them all on there. Gastrointestinal, you'll see C. diff, associated diarrhea, is a published side effect of penicillin administration. Did you know that? You can get C. diff. Sounds horrible. Colitis, vomiting, intestinal necrosis, death of intestines from penicillin. If you were at a gastrointestinal doctor and they took an image of your bowels, did a barium study where you swallow barium, it goes through your intestines. If they see a part of your intestines isn't working, they would actually say you have necrosis, and then they would cut that section out. And they do this often in Crohn's victims and ulcerative colitis victims. There's a part of your intestines that necrosed and died. We need to remove it. Did you know that was a published side effect of penicillin? Intravenously. Did you know that? Well, now you do. Lymphadenopathy. What? Lymphadenopathy. Have you heard of non-Hodgkin's lymphoma? These are lymph nodes that swell. Thrombocytopenia, blood clots in the brain. What? Leukopenia, loss of white blood cells. Like in AIDS? There's a side effect of penicillin? Amazing. Hemolytic anemia. That means you're bleeding out of your body. Nose, ears, throat, Ebola, Marburg, anybody? And you're losing iron as a result? Or you're hemorrhaging? All right. What about liver side effects of penicillin? Increased AST. They'll say you have liver toxicity. Cholectasis. Oh, you have problems now with your gallbladder. You got to have it removed. Abnormal liver function tests. Musculoskeletal. Joint disorders. Rhabdomyolysis. You want a painful muscle problem? Get rhabdomyolysis from penicillin. Exacerbation of arthritis. Anybody out there who's been told you have tetanus and you're elderly and you have arthritis already? Could you imagine getting a drug called penicillin and it makes your arthritis worse? Quadriceps femoris fibrosis and atrophy. Really? Your leg muscles aren't going to work anymore? They're going to shrink and waste away? No, I don't see how that benefits anybody. Psychiatric. Did you know that penicillin has these effects reported after it was brought to market? Nervousness, confusion, anxiety, euphoria, auditory and visual hallucinations, agitation, fear of impending, and psychosis. Ask your doctor if penicillin is right for you. What about ocular? Look at this penicillin. Anybody? Blurred vision and blindness? Ask your doctor if blindness is right for you. What I'm going to be showing you here are published natural antidotes to tetanus that you don't need to worry about penicillin side effects. And any medical doctor that recommends a tetanus vaccine as your cure or penicillin for it, you need to hand them the link or print out the PDF underneath the resources tab at the Dr. Ardis Show and hand it to them and go, how come you're not telling me that these natural substances, that these doses work? How about skin reactions to penicillin? Rash, peeling of your skin, mucosal ulcerations, urticaria, rashes all over your body. What about others? There's some other ones. Fatigue, chronic fatigue, pain, aggravation of existing order. I don't even know what Hoynes syndrome is, but anybody out there that has that? Did you know penicillin is known to cause it? Amazing. Metronidazole. This is another drug prescribed for tetanus infections. It has brand names of Flagyl, Flagyl ER, IV, RTU, and a whole bunch of others. 8 other brand names. I'm not going to show those. All right, so what are some of the side effects of this drug? Just know there's a black box warning from the FDA that says this drug has been shown to cause cancer in mice and rats. And I need to remind you all, the reason why human beings at pharmaceutical companies pay labs to test their drugs in mice and rats before they go to human trials is because mice have the exact same genes and organs that humans do. And all researchers state the reason why we study drugs and chemicals in mice first before we give them to humans is because if it happens in a mouse, it will happen in a human. So, anybody out there being diagnosed with tetanus and being told you need metronidazole, did you know it's published to cause inside of mammals before they gave it to you? And it's an FDA black box warning. Metronidazole. Top drug rank of all drugs prescribed in the world. It ranks 133 as of 2022. How many people are on that prescription? 4 million prescriptions. How many people do they believe are on it? 2 million Americans. Well, these drugs feed the industry and you're going to become a victim. All right. So this drug, what are its published side effects that are not just after they went to market? No, these were in the human trials. So anybody being told they have tetanus or a child has tetanus actively, and we need to give you this drug, metronidazole. I just want you to see what they publish on drugs.com are the published side effects from the human trials. 18% of people had headaches as a side effect. When you get to the GI part of this, just know up to 10% of all of you will have the inability to taste things that don't taste like metal. Everything's going to taste like metal, sharp, unpleasant, metallic taste of alcoholic beverages, and dizziness. Now, if you get to the GI side effects of this drug for tetanus, up to 10% of all people will have nausea and vomiting. Just so you're aware, up to 10% of you will develop a bacterial infection. Well, I just want you to know, tetanus is a bacterial infection. Ask your doctor if another bacterial infection is right for you when they prescribe metronidazole. Metronidazole. Maybe that's how it's pronounced. Respiratory symptoms and side effects of metronidazole. It's up to 10% of you will experience respiratory tract infections, rhinitis, sinusitis, and pharyngitis. I'd like to ask you, if somebody was battling tetanus bacteria, do you think not being able to breathe is an improvement? Up to 10% of all people, 1 in 10 on that drug will develop a respiratory infection. They can't breathe through it. Runny nose, pharyngitis, can't speak, mucus out of the throat. For skin reactions to metronidazole, you'll have fixed drug eruptions, swelling face, rashes on the body, drug reaction with eosinophilia and systemic symptoms. Yeah. Pustules. What about liver side effects? Increased liver enzyme, liver toxicity or liver failure in patients, drug-induced hepatitis. Ask your doctor if liver failure is right for you. Oncologic. This is studies of the drug. Breast cancer has known to be caused by metronidazole. So when they give this to you, just know breast reported after giving this to patients outside the studies, but once the drug went to market and was FDA approved, it's known to cause colon cancer, gastrointestinal, certain extraintestinal cancer, which they don't even highlight there. But look at the paragraph underneath there. And if you're interested in Crohn's disease, you might want to make sure they never give you this drug. Ocular. Did you know that it causes optic neuropathy, painful eye symptoms, blurred vision, decreased visual acuity, change in color vision and light sensitivity? The most serious side effects reported by metronidazole for tetanus is convulsions and seizures. Ask your doctor if seizures are right for your kid. Encephalopathy, aseptic meningitis in the brain. Optic neuropathy, eye nerve pain, and peripheral neuropathy. All arms and legs hurt all the time. Daptocel, the DTaP vaccine. Let's dive into that one. What are the side effects published about that? And you'll see the generic name is diphtheria, tetanus, acellular pertussis vaccine. I already defined that earlier. They state here for the DTaP vaccine, for those of you, if you got a kid who steps on a rusty nail, has a wound, and you're like, hey, have you had does your kid have a tetanus shot in the last 6 months? He should. Just know this, because the drug makers of the vaccines publish this. Contact your doctor immediately if your child has sudden weakness in their arms and legs. That would be scary. This could be a sign of a serious condition called Guillain-Barré syndrome. Guillain-Barré syndrome, by the way, is a cover for polio. They know that they call it Guillain-Barré syndrome now as a cover. No, it didn't. They came up with 2 new names for people who in the 50s and 60s. when they said polio vaccines eradicated polio. We're going to call them two things: Guillain-Barré syndrome, number two, acute flaccid myelitis. And they've been doing it ever since. So ask your doctor if polio is right for your kid with the DTaP vaccine. This vaccine will not treat an active infection of tetanus. I repeat, it does not treat an active infection. So if you have tetanus and they figure out you do, or your kid does, and they say it's time to give you a vaccine, you say, stop. I learned on the Dr. Ardis show you can't do it during an active infection. Your child will need medicines to treat these infections. And I just showed you the medicines they're going to recommend: penicillin and metronidazole. DTaP vaccines, they continue on drugs.com. Fainting may occur after you receive the vaccine. You may also have vision changes, numbness or tingling in your arms, hands, or feet, or jerky movements of the arms and legs. That's called a seizure, people. This may include seizures, fever, crying that will not stop, or severe redness or swelling where the shot was given. Now, check this out, everybody. This vaccine may cause apnea, breathing stops for short periods in some premature infants. Just so you know, when these kids stop breathing in their sleep and you wake up the next morning and they're dead, that they call that SIDS, and they tell you it had nothing to do with the vaccine. 90% of all SIDS, sudden infant death syndrome, where a mother or father found a baby in a crib who died in its sleep, 90+% of all those children in the whole world. DTaP also may cause short periods of time where the kid stops breathing. Ask your doctor if it's right for your child when they recommend the DTaP vaccine. Or seizures. Boostrix vaccine for tetanus, you'll see there listed. This is also drugs.com. This vaccine may cause a serious type of allergic reaction called anaphylaxis, which can be life-threatening. Ask your doctor if tetanus vaccine is right for you and your baby, or your senior citizen parents or grandparents, and requires immediate medical attention. Tell your doctor right away if you have a rash, itching, swelling of the tongue and throat, or trouble breathing after you get the injection. I don't know. Does this make y'all angry? If I went on the street like Jay Leno used to do and stand there with a microphone and ask questions of just lay people walking by, if I said this word to people, hey, random people on the street, is 90% of all Americans would go, safe and effective. Does this read like safe and effective as you have been programmed to repeat in your mind and to other people's all vaccines are? It is a programming, brainwashing, MK Ultra tactic to just repeat something over and over and over, and eventually they know people will believe the lie. Well, you're reading here what they published the can do. Does this sound entirely safe and effective? Fainting may occur. Fainting. This is a loss of consciousness, everybody. Fainting may occur after you receive this vaccine. May also have vision changes, numbness or tingling in your arms, hand or feet, or jerky movements of the arms and legs. That's called a seizure. Now let's get into the natural remedies for tetanus. Now that you know the truth about the vaccines, what they publish about them, maybe there's something safer, and that has been proven to work. Yeah. First, we're going to start with the American Journal of Clinical Nutrition. This is from 1999. The effect of dietary supplementing with black currant seed oil on the immune system of healthy elderly subjects. Very good. Now, black currant seed oil has been found to help stop what's called induration. You're going to read it here. Induration is the thickening of muscles, ligaments, tendons, the rigidity you read about with tetanus. It also happens in your skin. The black currant seed oil group showed significant increases in the diameter of induration in response to tetanus toxoid and the total diameter of induration of 24 hours compared with the baseline. The diameter of induration in the skin, the thickening of the skin in response to tetanus toxoid, was significantly different when they gave black currant seed oil, which is slightly different than black cumin seed oil. I do know that, don't worry. But I just want to show you this stuff. And I show you the induration. You'll see the induration, the thickening of that is reduced for tetanus, the two forms of tetanus toxoids they were evaluating, abbreviated TT and TM in the bottom red border there. This is right out of the research study. Nutritional supplementation has been shown to enhance the immune response in elderly humans. Change in both the total amount and the type of dietary fats has been shown to influence the immune response. In this study, we investigated the immune supporting effects of black currant seed oil, an oil rich in linoleic acid and linoleic acids, on the immune response of healthy elderly subjects. I'm going to read the last sentence highlighted on the screen. This increase, however, was significantly different from the change in the placebo group only in response to tetanus toxoid. When they administered black currant seed oil, they saw an improvement in the side effects of tetanus toxoid, different than the placebo group. All right, now we're going to go to some of my favorite stuff. This will be much easier if you want to dive into that research study. You can just know about black currant seed oil. But this is what I want you all to really start looking at, okay? You will hear all over the world that vitamin C is not proven to help all kinds of stuff. Well, I mentioned early, starting off this dialogue about tetanus, that vitamin C is already proven to cure 100% of all children with a tetanus infection. Not even that. No DTaP, no Tdap has those kind of figures. But I'm going to show you this research study where it does, and they keep repeating this research study over and over. Vitamin C for preventing and treating tetanus. Now, what's interesting, I just got to tell you, just the title alone, if you asked your pediatrician right now if vitamin C would help against tetanus, they're going to tell you no. Just flat out no. They don't know. They're going to need to learn from you. I'm about to show you medical research studies where they proved vitamin C could cure all children of tetanus. Even though vitamin C has dramatically decreased the burden of tetanus, this research study says, there are still about 1 million tetanus cases per year globally. We found one controlled trial that examined whether 1,000 milligrams or 1 gram per day of intravenous vitamin C would help in the treatment of tetanus patients. Vitamin C was used alongside standard treatments for tetanus. Intravenous vitamin C reduced the death rate of children aged between 1 and 12 years old with tetanus by 100%. 100% of all children lived who was given vitamin C for treatment for tetanus. And that 13 to 30-year-old patients, it saved 45% of them alone. Now, they didn't just give these people vitamin C. They were giving both groups, children and adults, normal drugs like I just showed you they treat tetanus with, and some of them cause respiratory arrest, heart attacks. I just showed you. But for the children, 0 to 12, they found that 100% of them all lived, even if they gave them the drugs. But as long as they gave them 1,000 milligrams intravenously of vitamin C, 100% of them lived. They also found 45% of all people older than 13 to 30 years old, were saved with vitamin C alone in combination with the drugs. Ask your pediatrician if vitamin C is right for your kid. A few laboratory studies have shown that vitamin C improved the functions of white blood cells called phagocytes and the proliferation of T lymphocytes, which are your T cells that kill bacteria called tetanus, indicating that it has roles in the immune system. In dozens of animal studies, vitamin C increased resistance against diverse infections and purified bacteria toxins like tetanus. The author Day in 1966 reported that 5 rats administered twice the minimal lethal dose of tetanus toxin all died, whereas 25 rats administered vitamin C either before or after the toxin, 100% of them lived. Vitamin C also reduced mortality in mice caused by toxins of several Clostridium species of bacteria. Vitamin C, everybody. Vitamin C. Any medical doctor out there that says to you, there's no evidence that vitamin C will work. Even if you're asking your doctors in a hospital, hey, what about trying intravenous vitamin C? They're all going to look at you and say there's not enough research about vitamin C. I can show you right now there are over 2 million research studies alone in PubMed.gov on the effectiveness of vitamin C for all conditions, all infections. And that is more than any drugs research studies combined. They've just been told there's no research on it. No, the truth is they're not looking. You got to watch the Dr. Ardis show to get the truth in these research studies. Another researcher in 1955 reported that tetanus patients had a lower plasma vitamin C blood level of vitamin C than healthy people. And tetanus patients who died had lower levels than those who survived. Changes in vitamin C metabolism provide a further rationale to test vitamin C for tetanus patients. Ask your doctor if 1,000 milligrams of vitamin C is right for you. The Dr. Ardis show has Immune C. 3 capsules contains 1,000 milligrams of vitamin C, exactly like in these studies. This is from the Annals of African Medicine. All those in Africa, we love you too. Vitamin C in the treatment of tetanus. One controlled trial carried out in Bangladesh in the 1980s has tested the effectiveness of vitamin C on tetanus patients. Jahan, the lead researcher, administered 1 gram per day of vitamin C intravenously to children aged 1 to 12. And none of them, notice they said they didn't give them anything else either. They just gave them vitamin C. Whereas 74% of those in the control group given drugs. Then they said both groups received conventional tetanus treatment. So I stand corrected. They actually gave both groups. This may be a reference to the same study of they gave them both drugs and vitamin C, but only the vitamin C group, 100% of them survived. Both groups received conventional tetanus treatment. That's medical treatment, so that vitamin C operated over and above the normal medication, over and above vitamin C. In patients aged 13 to 30, 37% of the vitamin C group paired with 68% in the control group. Ask your doctor if vitamin C is right for you. The particularly low blood level of vitamin C levels in tetanus patients compared with healthy control does give one way to rationalize the benefit of vitamin C administration in tetanus patients. All medical professionals out there, you got to use vitamin C intravenously for these infections. Everybody at home, you can use it orally. You don't need it intravenously. Everything that goes in your gut ends up in your bloodstream, which is why we educate you on organic diets and why there are better choices. That's vitamin C. Do not forget about vitamin C. 100% of all children 0 to 12 that they tell you need 5 different tetanus shots, you can cure them with vitamin C. Magnesium for treatment of severe tetanus, a randomized control trial out of the Lancet. The Lancet, by the way, everybody, is the UK's most trusted medical journal online. Our results show that magnesium had a significant effect on the muscle spasms and on the heart stability. The control of muscle spasm is central to the management of all patients with tetanus. Remember, they go all rigid and seizure. In this study, conventional first-line treatment was high-dose diazepam, followed by a non-depolarizing neuromuscular blocking agent called pipecuronium for more severe disease. If these agents failed to control the spasm, diazepam was replaced with midazolam, which, by the way, is a drug that has been banned from multiple prisons in America because it's too toxic to the people that are killed on death row. Midazolam, the same drug used by Boris Johnson in the UK to 45,000 people in nursing homes in April and May of 2020, midazolam, and then call it COVID-19. And trust me, I'm an expert witness on 2 lawsuits against Boris Johnson. I think I know what I'm talking about with midazolam. Therefore, the observed reduction in pipecuronium and midazolam use in the magnesium group is a significant clinical result and suggests that magnesium could be an effective and inexpensive alternative to these drugs. Magnesium worked better than the drugs to help with the spastic reactions to tetanus. The nervous system's dysfunction is a life-threatening complication of tetanus that manifests as a fluctuating heart rate, blood pressure change, and temperature change. This complication is very difficult to manage, especially if intensive care support is not available. In the unit where the study took place, verapamil, a drug, is the first-line treatment for these complications and was therefore assessed as a means of assessing the extent of the immune system dysfunction. The requirement for verapamil, the drug, was significantly reduced in those individuals who received magnesium. The predominant effect of magnesium was a significant reduction in tachycardia. I've done whole shows on tachycardia, people, and I told you magnesium was number 1. They even find it as a side effect of tetanus. They find magnesium reverses it. Changes in your heart rhythm. Since magnesium does not reduce heart rate in healthy individuals, it should be considered a drug in this case. There was a lower incidence of very low blood diastolic pressure readings in patients on magnesium. So as diastolic, you have systolic and diastolic high blood pressure and low blood pressure. When you look at your blood pressure, 120 over 80 is normal. 120 is systolic. The lower number is diastolic. Sometimes that diastolic number with tetanus will drop so low from drugs and from the infection that it could be life-threatening. Those people on magnesium never had that happen to them. A major objective of this study was to characterize the safety profile of magnesium in severe tetanus, not mild tetanus, severe tetanus. In other conditions like eclampsia and pregnancy, magnesium has been shown to be safe. But extrapolating to a very different disease state like tetanus and in different populations, for example, elderly patients, would be unwise. They don't want to try it on those people. Our study provides a reassuring safety profile of magnesium in severe tetanus. There were no obvious problems using magnesium in conjunction with the benzodiazepines or the muscle relaxants, or indeed both, in elderly patients and over long periods. Ask your medical doctor if your seniors diagnosed with tetanus would benefit from magnesium. How about all people with seizures, convulsions, spasms? Number one cause, magnesium deficiency. What about children? Yeah, you need to be on magnesium and vitamin C. Kids, parents of kids, pediatricians treating kids with tetanus, they should be on both vitamin C and magnesium. Magnesium, this is out of Anesthesia Medical Journal. Magnesium is first-line therapy in the management of tetanus. A prospective study of 40 patients, not one, not two, not three. Magnesium is a supplement which sedates, and a neuromuscular blocking agent has been shown to reduce tachycardia and hypertension in very severe tetanus patients. The dose is reduced to achieve a blood level between 2.5 and 4 millimoles of magnesium. In our series of tests of 40 patients, 36 of the 40 patients had severe tetanus, and at least 6 of them were predicted to have autonomic dysfunction, immune system dysfunction, and on the basis of incubation periods and how long it had lasted. Despite the predicted degree of severity, none of them developed hypertension or tachycardia that required intervention. Badly affected patients, the central sedative effects of magnesium may have contributed to its efficacy. They're putting the respected accomplishment of reduced hypertension that never developed and tachycardia to the magnesium that was used in the study. This is a earthclinic.com article, Natural Remedies for Tetanus, Effective Herbal Treatments and Tips. I want to highlight some of these for you because not everything does Dr. Ardis offer through the Dr. Ardis Show. I don't offer everything there. And I do know that many companies offer other natural products, and you should know where you can get them. So when I'm looking into research on tetanus, there are certain herbs that I don't sell individually, plant extracts I don't deal with, that I wanted you to know are options that have been proven in research studies also to be cures for tetanus. First is turmeric, or curcumin, as you probably heard it. Turmeric is renowned for its anti-inflammatory and antibacterial properties. Curcumin, the active ingredient in turmeric, has been shown to inhibit the growth of the tetanus bacteria called Clostridium tetani and reduce inflammation. Garlic is the next one. Garlic has strong antibacterial and immune boosting properties. It can help fight off infections and improve overall immune function. Vitamin C, we've already shown you, works at 1,000 milligrams or 1 gram. Mangosteen, a fruit from a tree. Mangosteen has been used in traditional medicine for its anti-inflammatory and antibacterial properties. It is effective in treating various bacterial infections, including tetanus. Magnesium, which I've already highlighted here. Magnesium is essential for muscle function and can help alleviate muscle cramps and spasms and seizures associated with tetanus. This is our biodefense product. Now, you just have to understand, Clostridium tetani is a bacteria. The tetanus is created by a bacteria. The ingredients in biodefense, we showed you black currant seed oil, black cumin seed oil is published to wipe out the same bacterium. So we use biodefense to help wipe out the bacteria that lead to toxin formation like tetanus. So biodefense, I would recommend 1 capsule in the morning, 1 in the evening. Immune C, vitamin C. There's your 1,000 milligrams. I show you highlighted on the screen in 3 capsules. And remember, for children, you can just open up these capsules or the liquid of biodefense and put it in a smoothie and blend it up. Pour it in applesauce, mix it up, let them eat it. You don't have to swallow the capsules. You just need the dose. Here's our magnesium complex, 400 milligrams or in 4 capsules there. That's where you can get it. It's an amazing product. I recommended turmeric here from Global Healing. I don't have my own product, but here's turmeric for those of you who are interested in having on hand for any tetanus concerns, or if you're diagnosed with tetanus or know someone who is, maybe you want to get turmeric from globalhealing.com. This is a product I found at GoPals healthfoods.com. It's mangosteen in a liquid form, and it's organic, superfruit juice, and you can just drink it. And you can get the whole fruit extract of the mangosteen plant that also helps with beating tetanus. It's probably delicious. And then this is a garlic extract from Mountain Rose Herbs. They're an all-organic company. I would recommend this garlic extract if you were going to use it and have it on hand. But this would be a garlic product I would recommend for those worried about tetanus. I've summarized for you what I would recommend for tetanus based on these research studies. Biodefense with this black cumin seed oil, 1 dropper full in an empty vegetable capsule twice a day. You take 1 dropper full of it, put it in an empty vegetable capsule, swallow it once in the morning, once in the evening. I've never told anybody to drink it straight or dilute it in water. It tastes gross. It's very potent extract of plants. Vitamin C is 1,000 milligrams daily. Magnesium is 500 milligrams daily is what I would recommend. You see the doses in our magnesium complex. You'll see the 3 different websites there, or links to the Dr. Ardis show to get the ones we offer. Then you'll see turmeric, mangosteen, and garlic, as recommended by those manufacturers, is the dose I would recommend to you. Remember, again, you can scan here. If you learned anything here you weren't going to learn from your medical doctor, I think you should be shocked. Even by the vitamin C thing alone, you should be shocked. It should be very exciting to you. All right. Also, don't forget our best-selling Audible book on Amazon and Audible right now worldwide. Still #1 bestseller around the world of all Audible books is my book, Moving Beyond the COVID-19, Restoring Your Health and Hope for Humanity. Now, this deals with a viral pandemic, but it's going to apply to all viral pandemics in the future. It's also just got basic principles you should understand about health and antidotes for everything exposed during COVID, those with long COVID, and those. That's why I wrote the book. You can scan here, get it at thedrdisshow.com. You can also get it on Amazon. There are 7 current books that are counterfeit books. They don't look like this. They just have the same titles, similar titles with my name on it. The one in white with the color atlas of the world divided by a syringe is my book. God bless you all. I hope you enjoyed this presentation. I hope you learned something about tetanus. My goal is to make sure you're not afraid anymore about tetanus. There are cures, there's antidotes. And I'm very excited that you now know the truth about tetanus and some of the natural remedies confirmed by medical science around the world. I'm Dr. Ardis. Dr. Ardis. This is the Dr. Ardis Show. God bless you. We'll see you next week at the Dr. Ardis Show.
Disclaimer. Please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider. Do not disregard professional medical advice or delay seeking it based on this presentation's information as the products or services purchased from it do not establish a doctor-patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.